Welcome back to the deep dive. This is where we take your source material, unpack it, and really get to those aha moments without all the noise.
Exactly.
So today, we're looking at something maybe a bit unexpected. Abdominal muscle injuries in athletes.
Yeah.
We've got some really interesting clinical research provided.
Yeah.
And our mission, really, is to figure out what these sources tell us about one specific and often pretty nasty type of strain.
That's right. And while, a rectus abdominis muscle strain or maybe a hematoma might not be something most people encounter, our sources show it's actually a really significant, very painful issue for athletes.
Sure.
Especially, it seems, tennis players. It causes serious abdominal pain, sometimes groin pain too. And what's, fascinating when you look at the research is how little we actually know about the epidemiology, like the overall numbers, incidence, prevalence, pretty much unknown.
Wow. Okay. So under-researched in the big picture, but clearly a huge problem for those it affects.
Definitely. But the sources, they do give us a clear sense of the impact and, importantly, how to approach it.
Okay, let's get into that.
Yeah.
That lack of broader data is really striking, isn't it? Especially for something that sounds so painful.
It is.
Makes you wonder. But okay, mechanics. We think tennis serve, maybe we think shoulder, elbow. What is it about that powerful movement that puts the abs, the abdominal muscles, at such risk?
That's the key question.
Maybe we should start with the basics first. We hear abs all the time, but what is the rectus abdominis, anatomically speaking? Why is it so important for an athlete?
Okay, good place to start. So the rectus abdominis, people often call it the six-pack muscle, right?
Right.
It's one of four main flat muscles making up that front and side abdominal wall. You've got the obliques, the transversus abdominis, and then this one.
Okay.
And it's actually a pair of muscles, like long straps, running vertically. They're separated down the middle by that tough fibrous band, the linea alba.
Ah, I see.
They start down at the pubic bone, basically, and run all the way up to attach to the cartilages of your fifth, sixth, and seventh ribs.
So quite a long muscle then.
Exactly. And their main jobs, spinal flexion, that's like doing a crunch or sit-up, and also compressing everything inside your abdomen and pelvis.
Okay, powerhouse sounds about right.
Yeah, and interestingly, they also have a secondary role in breathing out, helping pull the chest down. So yeah, pretty central to a lot of movement.
Right, much more than just crunches. It's a core stabilizer.
Absolutely.
And this is where it gets really interesting, that link to sports, especially tennis, which the sources highlight. How does this vital muscle end up getting injured in something like a tennis serve?
Well, if you look at the biomechanics of tennis, the abdominal muscles are just crucial, absolutely critical for keeping the trunk and core stable, especially during the serve.
I can imagine.
That serve, it's not just swinging your arm. It's this complex whole-body sequence generating huge angular momentum.
Right.
That force gets transferred up the chain, right to the racket. And it involves really rapid trunk rotation and flexion, often right after the back arch's, lumbar extension.
Okay, so a whip-like motion almost.
Kind of, yeah. And that complex, explosive movement puts tremendous stress on the rectus abdominis. And the sources consistently point to this muscle as the one most often injured.
Huh.
And interestingly, the risk doesn't seem to change much between different types of serves, flat, slice, kick. It's the fundamental mechanics.
So it's less about the specific serve type and more about that violent transition, that eccentric to concentric load you mentioned.
Exactly. That rapid shift is key.
Okay, so what does that feel like for the athlete? What are the typical ways it happens, and what symptoms should someone look out for?
Right. Well, patients often describe that mechanism, the eccentric to concentric action. It sounds a bit technical, but think about it like stretching a rubber band really fast, that's the eccentric lengthening under load, and then immediately letting it snap back to shorten powerfully. That's the concentric part.
Okay, I get it. Like loading and unloading very quickly.
Precisely. And under the huge forces of a serve, that rapid shift can cause, shearing stress. It can actually tear muscle fibers.
Ouch.
Yeah. Now, while that's common, the sources also mention injuries from just, a direct hit to the abdomen, acute trauma.
Right.
Symptom-wise, athletes might feel that deep ache, maybe a day or two later, what we call DOMS, delayed onset muscle soreness.
Sure. Everyone knows that feeling after a tough workout.
Right, but with an injury, it's obviously much more intense, more localized, and often there's a history. They might say, oh yeah, I've felt something like this before.
Recurring issue potential.
Frequently noted, yes. And then on exam, you'd typically find tenderness right over that muscle, often below the belly button, the umbilicus.
Okay.
And testing the muscle, seeing how it feels during during different types of contractions, like holding it steady, contracting it, or resisting as it lengthens that helps gauge how severe the strain is.
Okay, that makes sense. So once you suspect this, how do you actually confirm it? Do you always need, like, fancy scans?
That's a really important question, the diagnosis part. And often the answer is no, not necessarily fancy imaging right away. These rectus abdominis injuries, usually diagnosed clinically.
Meaning based on history and physical exam.
Exactly. It's generally quite distinct from, say, internal organ issues, so you can often differentiate it without needing immediate scans.
Okay.
Now, if there's a worry about maybe a rib fracture involved, then yeah, you might get a standard X-ray.
Makes sense.
For a closer look at the muscle itself, ultrasound can be useful. It can show, disruptions in the normal fiber pattern, maybe some fluid collection where the tear is.
Right.
But for the most detailed picture, the sources are pretty clear. MRI is the way to go.
Ah, the gold standard.
Pretty much. It gives a really clear view of how extensive the injury is. Muscle tears show up as bright spots, that's fluid signal, and any older scar tissue looks dark. It really maps it out.
That's really useful for understanding the extent, I imagine.
Yeah.
Now, the sources also talked about a clinical grading system. How does that work? How do you assess severity in practice?
Absolutely. The grading system is key for guiding treatment. It's based on pain response during specific movements.
Okay.
So grade 1, slight or mild cases, even when you do things specifically to provoke pain, they don't really feel it much or at all.
Right.
Grade 2, moderate injuries, now they get pain during concentric contractions, so doing a sit-up would hurt.
Got it.
And then grade 3, the severe ones, the pain is there even with isometric contractions, like a Valsalva maneuver bearing down, holding your breath.
Like lifting something heavy.
Exactly. Or even just reaching overhead. That level of pain tells you it's a severe injury. And this grading directly informs how you approach treatment.
Speaking of treatment then, does surgery ever come into play for these strains? Or is it always non-operative? And what does good rehab actually look like?
Yeah, great question. And the answer, based on these sources, is pretty definitive. Non-operative management is the standard.
Really? No surgery?
The research explicitly states there are no surgical indications for these specific muscle strains. It's all about conservative management.
Okay, so what does that involve?
It starts, as you'd expect, with managing the initial pain and inflammation. So rest, meaning no tennis, obviously.
Right.
Cryotherapy, ice, and just avoiding anything that aggravates it. Then comes the rehab, and it's a very structured 5-step protocol, according to the sources.
5 steps. Okay, what are they?
First, control the pain and inflammation, like we said. Rest is key here. Second, you move into gentle isometric strengthening, contracting the muscle without moving plus stretching.
Okay, isometrics first.
Then step 3 is concentric strengthening, actually is shortening the muscle against resistance, like a controlled sit-up. Step 4 gets more advanced. Eccentric work, controlling the lengthening, and plyometrics, those explosive movements.
Getting back towards those sport-specific actions.
Exactly. And finally, step 5 is all about maintenance strategies, how to prevent it from happening again. This whole structured progression is crucial for getting function back, improving performance, and really importantly, stopping it from recurring.
So a really methodical approach.
Yeah.
It sounds like just telling someone to rest isn't nearly enough.
Not at all. It needs that careful progression.
Okay, so we've done a pretty deep dive here into rectus abdominis strains, focusing on athletes. We've looked at the tricky biomechanics, how something like a serve can cause this.
Yeah.
We've understood the diagnosis, the grading, and this very specific non-surgical path to getting better.
And if you think about the bigger picture, it just highlights how incredibly specific you need to be when understanding and treating sports injuries, right?
Absolutely.
It's not just a generic rest and recover. It's this carefully planned rehabilitation that needs to mirror, in a controlled way, the very movements that caused the problem in the first place, rebuilding resilience gradually.
That specificity is really striking. What stands out most to you from looking at this material? Maybe it's that surprising lack of broad epidemiological data you mentioned earlier.
That's definitely part of it.
Or perhaps the detail in that rehab protocol for what seems like, on the surface, just a muscle tear.
Both are really interesting points.
For you, the listener, maybe thinking about this, considering how tailored and specific this recovery process has to be for just one type of injury, what does that suggest about the growing need for really personalized approaches, not just for pro athletes, but for all of us, when it comes to health, fitness, and performance? Something to think about.